Menopause is taken from chapter 61, menopause and postmenopause. Some essential items are the following. Natural menopause is diagnosed after 12 months of amenorrhea with non-obvious pathological cause. The average age is going to be 50 to 51 years in the US. Estradiol levels are going to be very low, less than 20 picograms per ml. But the follicular stimulant hormone, or FSH, is going to be very high, and it's part of the diagnosis. The induced menopause, it's defined as a permanent cessation of menstruation because of bilateral oophorectomy or because of ablation of the ovarian function due to radiation or chemotherapy. Premature menopause is going to be defined of reaching the menopause before age 40. Perimenopause or menopause transition is also defined by menstrual cycle irregularity and hormonal changes that occur 4 years before or 12 months after the final menstrual period. Those perimenopause, that perimenopause period is going to be characterized by vasomotor symptoms like hot flashes, insomnia, uh, dryness of the vaginal of the vagina, and also urinary symptoms with infections. Pathogenesis of the perimenopause stage. We are going to see in a woman that is young that the mean cycle length is around 35 days, but by age of 35 it's already 28. So the mean cycle length starts to reduce due to a shortening of the follicular phase. Also, the luteal phase length will remain constant, but after 45 years, the ovary starts aging and the woman starts having irregularity of menstruations. So progesterone levels maybe will stay, there's no difference from that a level observed in younger patients, but estradiol levels are going to be lower, and also uh, they're going to be lower during the follicular maturation of the ovaries, and also during the mid-cycle peak, and also during the luteal uh, phase. Concentrations of the follicular stimulant hormone are going to be high due to low levels of estradiols, and we are going to be seeing also that the luteinizing hormone, or LH, concentration are going to be the same as seen as younger women. So when we see an early rise of the FSH, usually it is done because we don't have a negative feedback from inhibin. Inhibin also lowers its level during perimenopause, and it does not produce a negative feedback over FSH, and that will result in high levels of that FSH. So, transition to amenorrhea will be characterized by high levels of FSH, also with menstrual irregularity. During that menopause transition, high levels of FSH appear to stimulate only residual follicles and to secrete a little bit of burst of estradiol, and occasionally those estradiol levels will rise up to higher, 2 to 3 times higher concentrations of normally, and it will be sometimes recruiting more than one follicle for ovulation. What happened is that transition to amenorrhea sometimes is characterized by persistent estrogen and also irregularity of the cycle, and this may follow by a corpus luteum formation often with limit secretion of progesterone. Because of the episodes of follicular maturation and also vaginal bleeding are very widely spaced, premenopausal women may be exposed to a persistent estrogen stimulation of the endometrium in the absence of regular cycle or cycling of progesterone secretion. When we have a physiological menopause, it's important to remember that at the time of birth, we have around 1 to 2 million oocytes, and by puberty, we only have 300,000 to 500,000 of oocytes. That continued reduction of the number of the oocytes occurs during all the reproductive years until we have a complete atresia of or involution of our ovaries. So menopause occurs in a human female because of two processes. First, because we're oocytes responsive to the gonadotropins hormones disappear. And second, because a few of the remaining oocytes do not respond to the gonadotropins. Risks for menopause, it seems like there's no consistency between the menarche age or and the age of menopause, or any relation between being married or childbearing, height, weight, or the prolonged use of contraceptives pills. That seems not to appear to influence the age of menopause. However, smoking, it is associated with early menopause. Spontaneous cessations before age 40, it is called premature menopause, and it's can be done can be seen also in a primary ovarian insufficiency. There is risk factors uh, related with infections, severe infections or tumor in the reproductive tract, also with the use of radiation or chemotherapy drugs, and also risk factors due to chromosomal abnormalities like the Fragile X syndrome. Artificial menopause is caused by surgical removal of the ovaries or by the use of radiation that will produce like the removal of oophorectomy, bilateral oophorectomy that sometimes is used and followed by an hysterectomy, maybe to prevent ovarian cancer or maybe some other genetics disease, preventing and prolonging the prognostic after an ovarian or genetic background. They take both ovaries out and they can do an elective surgery to a laparoscopic oophorectomy. Also, the use of treatment because a patient having endometriosis, they can treat with also if they have a breast cancer, they treat with those breast cancer that have receptors for estrogen and receptors for estrogen in the breast or in the endometrium. So also artificial menopause is used for the treatment.